Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of Turner syndrome are there will be edema of hands and feet. It is primary amenorrhea, exogenotype is seen, and you see streak ovaries. Then all are the features of Turner syndrome except. So in Turner syndrome, the karyotype is 46XO, not 46, it is 45XO. Normal breast may be seen, especially in mosaics. Underdeveloped uterus, normal secondary sexual characters, and primary amenorrhea. So this is the wrong statement.
Actually, in this question, if 46XO is not given and it is given as 45XO, then you can select normal breast. Normal breast is normally not seen in Turner syndrome, but there is a category of Turner syndrome where there are mosaics. That is, in mosaics, half of the chromosomes will be 45 XO, whereas the rest half will be 46 XX. So, as a result, in them we will see normal breast development.
But actual Turner syndrome, the normal breast will not be there. I'll explain this question again. Okay. I'm explaining the question 243 slide, 18th question. All are features of Turner syndrome except. So the karyotype actually it is 45XO, not 46XO. Normal breast is not seen in Turner syndrome. There will be underdeveloped uterus. True. Normal secondary sexual characters will not be there. Okay, and there will be primary amenorrhea. So here the question is except. So these are the correct options. These are the wrong statements.
thank you and thank you for watching.